Hello, everyone, and welcome to a festive episode of The Wrap, brought to you by Michigan Medicine Headlines. I'm Dan Ellman with the Department of Communication.
And I'm Hunter Mitchell, Dan's long-lost co-host, and I'm back to help celebrate the past year at Headlines.
And what a year it was, Hunter. We've had 34 episodes, more than 50 guests, and a ton of topics to talk about. So today, we'll look back at some of the most memorable episodes and moments to make sure our listeners and viewers haven't missed a thing.
Well, we can't do a year in review for 2021 without, of course, covering the ongoing pandemic. Back in April, Dr. Sandro Cinti joined the Wrap to discuss COVID-19 vaccines and why they're so important. So much of what he touched on is still relevant today. Let's take a listen.
There are different reasons for people being on the fence. Some people are concerned about the side effects, and I would say that the side effects after hundreds of millions of doses, there are very few side effects, and they're all manageable, and people do fine. Some people are concerned about the components of the vaccine. There's no hidden messages in there. It's not going to get into your DNA. It's even safe for pregnant women to take these vaccines.
Now, a few weeks later, the Wrap discussed another topic that has come to the forefront during the pandemic: burnout. Here are a few ways you can identify and manage burnout, should it be an issue in your work life.
Well, most of us cope with stress most of the time, and we do so on our own well, or by talking with friends and family. So we believe that we can wait it out for the most part, and seeking professional help just doesn't come naturally to us. But it's when our own ways of coping and talking with friends and family aren't working well enough that's when brief professional help can help. Reasons why we might not go: we might feel embarrassed to go or ashamed to go. We might be afraid that other people are going to find out and think less of us. We may not have the time to take off from work, or we may not know where to go. The reason it's so important to go is because waiting too long can make things worse and harder to treat. So especially if we're taking our frustration out on others, overusing substances to cope, or feeling depressed.
Outside of COVID, we had plenty to talk about this year. One of our most popular episodes, believe it or not, was centered around sleep. Take a listen to the Michigan medicine expert, Dr. Niraj Kaplish, who discussed how you can improve your sleeping habits.
So sleep is in the same breath as exercise and appropriate diet that we do to maintain our well-being. So sleep recharges our mind and brings a positive attitude for us. Also makes us improve our learning by improving our attention, energy levels, and also help us heal and recuperate. And you will be surprised to see that sleep also makes us look good. You know, when we don't sleep well, our eyes are so baggy, and people can notice that. So sleep is very important, especially in the pandemic time, because good sleep leads to good immunity and a good vaccine response. So I think so this is very, very critical in these present challenging times.
One of my favorite episodes was on a topic near and dear to my heart: accessibility. We were joined by Krista Moran of Interpreter Services to talk about how we can make Michigan medicine as accessible as possible to employees, patients, and their families. Here's a bit of that conversation.
The patients that are most marginalized and the patients that are having the biggest struggles are those that are facing these barriers. So we're not just talking about physical barriers. For example, for our limited English proficient patients and deaf patients, that barrier might be communication. And so we provide interpreters. But there's also things like physical barriers, clinics that might not have doors that are wide enough for an electric wheelchair, for example, clinics that might have exam tables that don't lower so patients can get up there. So maybe even a patient in their everyday life might not really consider themselves as having any kind of limitations, but when they get into an exam room that is inaccessible to them, an older patient maybe who can't climb up on that table and requires help, the goal is to really take down those barriers for these patients to be willing to come in.
Last but not least, we had an important campaign launch in 2021 that has shaped and unified our messaging on the Michigan Medicine brand. We were joined by the Department of Communications' very own Director of Marketing, Rebecca Priest, who was able to give us valuable insight into the new branding campaign.
So we have had a few sort of mini campaigns here and there, but we saw going back about 2 years now, because the pandemic kind of put a little delay on things. We saw kind of our data about the way people feel about our brand and their awareness and their understanding of what Michigan medicine means. And the fact that there's kind of 3 different parts of Michigan medicine that come together in a really unique way. That was really just something that was lost, I guess, if you will, in our external audience. And it's just not a good health indicator of your brand to have the numbers going in that direction. So this was the right time really for us to be looking at reintroducing a campaign that helps our community understand our impact and reflects the work of all the people here, all the really important things that get our people up in the morning and drive them when they come to the office. So we're excited to be able to help reflect that back to our community.
Well, that's a look back at just a few of the more than 30 interviews we carried out this year on the Wrap. If you want to listen to the entire conversations and find all the other episodes we haven't touched on today, you can find the Wrap on iTunes, Stitcher, Google Play, or any other podcast hosting platform. The Wrap can also be found on the Michigan Medicine YouTube channel and is part of the Headlines Week in Review.
Well, with that, we want to give a big thank you to all our listeners and viewers for everything that you've done for patients, families, and each other during another challenging year. Happy holidays to all, and stay safe and healthy as we move into 2022.
We'll see you next year.